Carl. My name's Ginny. This is Deb, who's another anaesthetist who will be one of our Huntsland intubators. And we're just looking at this box, and I wanted to show you some of our thoughts with it. It's great, by the way, but a few modifications for us would be great. So, Kirsty, if you can just show the box. So what we're going to do is just simulate some pre-oxygenation. And at the moment, the end of the Air Viva, there's not really enough room. So I, probably angle it into the corner. But ideally, it would be great if we could just angle it down the patient's body, because then we'd have more room. See how it's getting stuck here? So we would pre-oxygenate the patient, and then we would like a hole or two here, as other people have asked for, so that Deb, my anaesthetic assistant, can pass me equipment. This is a glide scope, as you know. And I've got a Parker tube loaded on the glide scope introducer. And I'm going to intubate the patient. Deb, can you take the introducer out? This is a bit where it's hard to get the introducer out in the box. And then I would connect this up, hold it. Deb's going to put some air in the cuff. Sorry, it's a little and then we're going to ventilate the patient. So all good from this point of view. We would then secure the tube and look at taking the box away and putting the patient on a ventilator. So I also want to show you what happens if we have trouble with an intubation. So let the cuff down for me, Jeff. So I'm going to simulate, if you could put the introducer back in there, I'm going to simulate what would happen if we had trouble with an intubation.
Where's the bougie? It's the bougie, I said that. Great, thank you.
So we're thinking that the first piece of equipment we might like to use if we fail with the glide scope and the glide scope introducer would be a flexi tip bougie. So I'm just going to demonstrate, I'll keep that outside, Deb, just for 1 sec. I'm just going to demonstrate what that might look like in real life. So I've pre-oxygenated. I've had a look at the larynx. I've got a not very good view. And I'm trying a blind intubation and I can't intubate the patient. So then I'm going to ask my anaesthetic assistant for a flexi tip bougie, which would hopefully come in through a side hole. And flip the tip up. These don't fit all, and this one's got a bit of goo on it, but... Okay. So I'm just finding the box a tiny bit restrictive with my arms at the moment, but I've got it probably in there, and I'm going to pass that in, and then Deb's holding the end of the bougie, and I'm going to intubate the patient. This is a mannequin, so it's not lubed and I don't have the right tube on this bougie, but we'll say that that goes in. And then the bougie comes out. And then we're here. And we're ventilating our patient. So as you can see, what I'd like to do is keep the volume, as we discussed in the box, as low as possible to make the suction or the negative pressure in there as effective as possible. So what we need to do is take off this perspex from about here down. I also think in real life, the patient's neck is here, the start of their chest is going to be here, and this is probably too low for some of our bigger patients. The whole box is going to be tipped up and not sealing very well.
I might have that
So,
as well.
yeah, so if we could take that off along here, and maybe 2 holes the same size as this here for our anaesthetic assistant, and as other places have told you, we would put a large tegaderm on those to seal them if they weren't required. But we're also wondering if perhaps silicone cuffs that you can put your hands through in all of these holes would be a possibility as well. So there are thoughts. Oh, one last thing. I've also got double suction hooked up here because we need airway suction available inside the box, as well as the suction attached to here, but that was pretty easy. Alrighty.